Thank you, Sarah. DFL lawmakers in Minnesota are pushing for legislation aiming to improve health care for mothers. The goal is to reduce the number of moms and babies who die during childbirth. It should also improve their overall health and well-being. KIMT News 3's Berg is joining us now to talk about the legislation and how it could impact new families. Evan.
Jess, several different aspects of maternal health were brought up at a news conference today at the state capitol. 5 different bills covering issues before, during, and after pregnancy were highlighted by DFL supporters. Senator Liz Bolden from Rochester was one of the legislators speaking out about these issues. Their message centered around how these bills could reduce maternal mortality within the state and also lead to better health outcomes for women during and after pregnancy. The bills discussed would attempt to make working in healthcare more accessible through a state licensing program for midwives, make infertility treatments more affordable, and offer a greater degree of postpartum care for mothers after birth.
Many barriers remain, especially in greater Minnesota, for people to get access to the maternity care that they need. Now this year, it is time for Minnesota to once again be a leader and take the steps necessary to tackle this maternal care crisis facing so many Minnesotans.
According to the Minnesota Maternal Mortality Review Committee, over 80% of maternal mortality is preventable, but prenatal and postpartum medical care are essential to lowering that number.
Thank you, Evan. These bills are in the process of discussion in the current legislative session.